Tell us when you're ready. Good. Well, good morning. Serving as Kentucky's Attorney General has been one of the honors of my lifetime. Aside from my family and my faith, it's given me more purpose than I could have ever asked for. The reason that I feel that purpose is because every day we get to serve a very important mission. That mission is that every Kentucky family, every single Kentuckian, ought to be able to live in a safe neighborhood and have a real path to prosperity. But what is a safe neighborhood? It's not only a neighborhood free from violence and free from drugs, but it is most certainly a neighborhood free from sexual assault, rape, and forms of sexual violence. We've worked every day in this Attorney General's office to do everything we can to change what is a rape culture in this country and in this state. Our statistics are nearly 1 in 2. Nearly 1 in 2 Kentucky women face some form of sexual violence in their lifetime. It is absolutely unacceptable. As a son and as a husband and as a dad of a 9-year-old daughter, we absolutely must build a better world where everyone is not only respected, but everyone is safe, and we do not live in this type of culture. We've worked on so many initiatives over the last 4 years. One of the most important is our work to end Kentucky's rape kit backlog. When I came into this office, we had over 5,000 untested kits, and thanks to the work of so many across state government, each and every one of those kits has now been tested. This office provided over $4.5 million to our state crime lab to make sure that we would never have a backlog again. We performed training all over the state to ensure that these kits were prioritized, they were invested correctly, and that we used a victim-centered approach, not just on investigating those cases, but on every case of sexual assault. And we created a cold case unit running out of this office. And along with our Commonwealth attorneys all across Kentucky, we have now announced 10 indictments coming out of that backlog, with many more to come. We launched our Survivors Council, which is filled with some of the bravest people that I have ever met. They have worked tirelessly to make sure that we not only live up to our promises to be victim and trauma-centered, but they have also changed what goes on in this Capitol, I think, for good. One of the original Survivors Council members, working with others, just over a year ago, helped end child marriage in Kentucky. It shows how powerful this group is, and they recently created one of the first guides for victims, for survivors that are out there, and being willing to face their own trauma to help others, to provide resources they know should be there, is truly inspiring. We've been to college campuses all across Kentucky, knowing that we still have an unacceptable level of sexual assault on our university campuses. We have worked with each and every one, and to see those universities then every year doing more and more, whether it's WKU, where we go down every single year, or others, it's truly inspiring to see others who have increased their efforts to change this culture. And we have, I believe, taken Kentucky from behind the curve to leading this country on how we address human trafficking. Just this last year, we had more arrests of traffickers, but more importantly, more saves of victims than in any 2 or 3 years of our history combined. We're providing more services than ever before to those victims of untold trauma, and we believe that this is just the start, that Kentucky still has the possibility of being the very first state to end human trafficking, and it's something that I want to see in my lifetime. But there is still so much more work to do, and there are amazing partners out there to do that work with. So last year, we again joined forces with the Kentucky Association of Sexual Assault Programs, or KSAP, a partner that we have worked with over and over these last 4 years, whose work is absolutely instrumental in trying to end this culture of sexual assault, to ensure that victims of sexual assault receive proper attention and care when they have the courage to go to the hospital. We have to understand that this is typically right after they've been assaulted, right after they've been violently traumatized, which means the moment that survivor walks into that hospital and how they are treated is absolutely critical. that we have to get it right every single time because it is one of the most important moments in that person's life. So my office provided KSAP with $30,000 in settlement funding to create a training program and video specifically for hospital staff. The video and training program are now ready and available to every hospital with an emergency room. What that means is if we do this right, if we get this training implemented, that every time a survivor of a sexual assault walks into an emergency room, they should be greeted. They should be interacting with someone specifically trained to help them at that most important moment to get it right every single time for every single person. The training provides employees with information regarding their legal obligations to provide a free sexual assault forensic exam kit for all victims. We are seeing through this backlog and through our law enforcement efforts that there are so many repeat offenders out there, so many serial rapists. And the importance of collecting evidence every single time we can means not only securing justice for that victim, sadly most likely past victims, but preventing future victims. It includes the obligation to contact the local rape crisis center to provide for advocacy. Those are amazing centers filled with amazing people who do great work and who need to be involved in each and every case. An obligation to contact law enforcement to collect kits upon victims' consent. In other words, no more untested kits for any reason ever moving forward. And to preserve all safe kits not reported to law enforcement for at least 1 year. The training video also highlights the importance of a victim-centered treatment and investigation. The idea that the most important person involved in any crime isn't the perpetrator, though we want to bring them to justice. It is the victim or the survivor of that crime. That everything we do has to be centered on providing healing and proper care from the very first moment that they have the courage to make a call or show up in that emergency room. This effort is important for ER staff as many hospitals experience a high turnover rate and new employees may be unaware of the legal requirements. We are proud to have the Kentucky Hospital Association's support for and involvement with this training effort and appreciate their commitment to serve their communities. This is an example of our hospitals truly being beacons of health care, of putting patients and their trauma first and doing the right thing. Their willingness to embrace this and having absolutely no hesitancy to do it is an example of how there are still so many more partnerships out there that we can engage with and in to end Kentucky's rape culture. We will change that culture. We have to change that culture for the next generation and the one after that. But it takes all of us working together. I now want to introduce a true champion in this area, and that's Eileen Rechtenwald from KSAP. Eileen? Thank you. I'll tell you what, I'll move over here.
We'll go this way.
We'll balance out.
We'll dance over here. Good morning, and thank you to General Beshear for inviting all of us here today to unveil yet another important step toward bringing justice to sexual assault victims, a tool to increase knowledge among hospital administrators and give them resources, and healthcare professionals who perform sexual assault forensic exams in Kentucky's emergency department. My name is Eileen Rechtenwald. I'm the executive director of KSAP, Kentucky Association of Sexual Assault Programs, the association of Kentucky's 13 regional rape crisis centers that General Beshear spoke of. In 1996, Kentucky became one of 2 states in the nation to credential registered nurses as sexual assault nurse examiners, or SANEs. We've been at this quite a while. On completion of approved curricula through the Board of Nursing, which is unusual. Until that time, only doctors could conduct the sexual assault forensic exam that involves the collection of evidence, so very important to the criminal investigation of a sexual assault. From then until now, KSAP has trained hundreds of nurses. The person that trains them was sitting right there. and has greatly enjoyed seeing other states follow our lead. Yet, more needed to be done. Not every hospital employs or contracts with SANES to conduct exams. So we work to expand the types of healthcare professionals who can provide exams to include advanced practice registered nurses and physician's assistants. The goal of this video is to make sure that hospital administrators and all healthcare professionals who respond to sexual assault victims are well versed on the legal requirements and the general guidelines for performing these exams in a victim-centered, compassionate way. The video goes through the step-by-step process of completing a head-to-toe assessment, providing medical treatment, as well as the collection of forensic evidence for use by investigators when victims choose to report to law enforcement. Many of us here today have worked to make sure every sexual assault kit in Kentucky is tested, and thankfully that is happening. Of equal importance is ensuring that victims who seek these exams are provided high-quality, compassionate, trauma-informed care. Undergoing a sexual assault forensic exam can be quite daunting and painful. But survivors tell me it can also help them on their long journey to healing. We would like to thank the Office of the Attorney General for awarding us this great grant to produce this training video. We also want to thank the Kentucky Hospital Association for partnering with us on this project. They have been great partners, very responsive. Kentucky Hospital Association plans to promote the video and make it available on their website so that all hospitals will have access. We are grateful to all the writers of the script and the actors in this room, raise your hand, who worked pro bono because they are passionate about serving victims. And to KSAP consultant Stephanie Holscher, and to the project director, Melissa Gilpin. And to Dave Harl's Pinnacle Productions team in Lexington, who, when I thanked him for the great job he did, he said he was honored to be able to participate in the project. Thank you, General Beshear, for the money and the idea. It was a great idea.
Thank you.
Hi, I'm Donna Metter. I'm the Director of Patient Safety and Quality and Health Professions at the Kentucky Hospital Association, and I'm pleased to be here today. Kentucky's hospitals provide compassionate and competent care to victims of sexual assault. Hospitals are there for their communities 24/7, 365, and KHA is proud to support their efforts to provide the highest quality care to people at such a difficult and vulnerable moment. Thank you all very much.
Thank you.
Thank you.
Gretchen?
Good morning, Gretchen Hunt, Director of the Office of Victim Advocacy, and I just want to introduce Hillary Sykes, who's a member of our Survivors Council, and I just want to emphasize that this effort, along with others, has been to not just provide services to survivors of sexual assault, but to really center survivors. And I also am aware that when this video goes out, it sends a message to all the survivors working in our hospitals. It's not simply the patient across the table, but it's the strong survivors, both men and women, who serve in our hospitals, as they serve in law enforcement, in prosecution, as judges, in all those settings. And that's a larger part of our culture change, is to reduce the stigma around sexual violence so that people will be able to come forward and speak. So it's my honor to introduce one of our members of our Survivors Council, Hillary Sykes, who would like to share a little bit about how important this video is for survivors of sexual violence. Thank you, Hillary.
Morning.
Good morning.
When hospitals know the rights of survivors and how to perform a SANE exam, it shows. This video is important because it gets everyone on the same page of what is required so that a survivor can focus on feeling safe and making decisions for what is right for them. With implementing this video, hospitals stand with survivors to say, We are in this together, and we are going to try and help you heal emotionally, physically, and mentally as best we can. I appreciate the Attorney General's Office and Kentucky Association of Sexual Assault Programs for working on this, and I look forward to it being available to hospital employees all around Kentucky.
We're all in this together. We're now happy to take questions out of respect for the folks that are working on this project. Let's take questions on the project itself, and then if we have any other official questions, I'll take those without them having to stand up here while I answer them. So, yes.
How long has the program been underway before you are today?
Little over a year from start to finish, and let me thank my staff, because some of the best ideas certainly don't come from me. They come from amazing people who are dedicated, and I hope who are empowered to do the type of amazing work. I also think they come because we listen, because we're actually out in the survivor community, because every day we have survivors coming in to be a part, and I think they feel like a part of this office. And I believe a lot of the progress we've been able to make has been from listening and then trying to address those needs, but addressing them with survivor input. Anybody else on this project? All right.
Okay.
Thank you.